Hi everybody, I know it's been a while since I have been on here, and I always keep saying, oh, I'm going to come back all the time, and you know, that doesn't happen. But I did want to talk about a couple of new things. There we go. I know I had talked about my medication before, and one of the new medications I have, that's HUMIRA. And I really think that this medicine has kind of saved me. I don't know, I wouldn't call coming back from, you know, the brink, but, you know, given me a lot of my life back. So this is it. It comes in a shot form. You can also get it in a EpiPen that my doctor, who's awesome, said that if you get the EpiPen, sometimes all the medicine doesn't come out. So I get it, there we go, sorry, getting backwards this way, and I take it every 2 weeks, and it does hurt, I have to say. You can do it in your arm or your leg. I choose to do it in my leg. Just, I guess, a little easier. And you have to go, once you get the medicine, your doctor has to kind of give you a course on how to give you the shots and everything. But I will say, since I've started this and the methotrexate together, things have been really great. I have been, you know, gotten colds and things, so those times I have had to stop my medication. I will say, when I started anyway, the HUMIRA, I did have sickness. My stomach was really upset, and that might have just been because my digestive tract was a hot mess. Any of you that have been following me kind of know my situation with that. If you're new, I just have never had a good digestive tract, and then once this came along, and all my medications, I have 15 now, medications now. So I lost one, but then I got one. So, so I take 15 medications. A lot of them are for pain. Once I start taking all of those, then my digestive tract became even more a mess. I tried at one point juicing for a year. That didn't work for me just because my particular setup with my digestive system, I need like food, and I need protein and all those things. I've been able to be off prednisone now. I'm going to think it's been at least 6 months. So that's really awesome. I've been able to lose quite a bit of the weight I got from that. The last bit is a little harder to, you know, lose just because of the working out issue and being exhausted. And if I push too hard, which I do because I just want to get back out there and work out like I used to, then I get really tired and I'm a hot mess. So I'm trying to figure it out. It seems if I just do daily stuff like cleaning and playing with my daughter, then, you know, then I'm pretty good. I had a bad bout again last night, just feeling nauseous and just so exhausted, and just so last night was not very good. But I'd say I have less of those days of the super crazy feeling bad and more days of just exhaustion and some pain still that will always be there. I think the pain has receded a bit with the medicine. Mostly, a lot of that's been better is my exhaustion, brain fog. I had horrible brain fog. If you look at maybe some of my past videos, or if you know me personally, you know that, oh my gosh, it just used to be really bad. And sometimes it's still memory problems, sometimes still speech problems, but overall, much better. I have been trying to eat better, more vegetables. Also, I've been trying to not have coffee, because as we all know, it dries you out. And I've been trying to not have any Diet Dr. Pepper, but that also kind of acts as an extra laxative. Gross, I know, but and I mean, it does help sometimes with my energy, but sometimes it also messes with it. The new stuff that I'm trying, that I had spoke of last time, it's an energy drink. There's a new one out called Renew. It's all natural, and it's supposed to be good for your eyes, for your hair, your skin, your nails. I mostly want to see with my eyes. I know a lot of you ladies out there have dry eyes and dry mouth and lots of dry issues. If I can completely get off, you know, coffee and pop and just do this, I'm hoping, you know, to see some improvement in that area. And I'm going to keep you guys posted on that. You know, if something works, I want to talk about it. And it's exciting because it's all natural, so it's not like Red Bull or Monster. Not that there's anything wrong with those brands or any other energy drinks, they just don't have as much sugar, this one. So it's gentler on our system. So if it starts, you know, working, I'm gonna, you know, show you guys some and tell you where to find it and stuff, because, you know, whatever we can all share and be helpful to each other. Let's see. As you can all see too, I have red hair now again. My usual red hair, blonde hair, red hair, blonde hair, short hair, long hair. That's all back in. You know, I know a lot of you ladies that have watched me before, a lot of you that I speak with or communicate with. You know, a lot of you guys have had some successes, and some of you guys have had some really heartbreaking turns, and I'm really sorry about those, and my heart goes out to you guys that aren't doing well. If you're in Colorado and you're kind of in the north area, Dr. Anita Zachariah from the Colorado Arthritis Clinic, she's the one that, I mean, transformed my life. She's amazing. I know there's other doctors out there that are great. So just keep fighting. You know, it took me 3.5 years to find a good rheumatologist, and a long time. So we're trying to get off medicines. Prednisone, finally got off all of that, like I said. Gabapentin, I went from 2,400 milligrams a day just to 6. So that's pretty huge too. So we're trying to see what medicines actually work with me and what ones I'm just still taking, because, like I said, I have 15 different medications. I know that 2 work. This one and my methotrexate, and I still have to take the morphine. I've been on that for 4 years since November, and that's for the pain. Like I said, I'm mostly on pain medicine. 2, 3 things for like the fibromyalgia. Oh, and that's new. I'll tell you that in the second part. So go to part 2. My computer, it's crazy. So this part 1, go to part 2.